Hi, Dr. Birchall here. We are excited that we're getting ready to open up at Dermacare, and we are making some preparations to be safe. We have our safe reopening plan in place, working hard to get all the details worked out. Before you get here, there's some things you can do to help us with that. And so one of those things is everybody has to wear a mask when you come to our office. Both patients and staff will be wearing that. For the sake of this video, since my camera person is more than 6 feet away from me, I'm going to take it off so you can hear me better. And there we go. But you're going to need to wear a mask. Let me put that down. Other things you can do, make sure all your personal effects can be kept on your body in your pockets, and pretty much bring your credit card, bring your keys, and bring your phone and glasses. Leave everything else away and make sure those on your body so we don't need to put things on the counter. Our strategy is going to be to make this the cleanest place possible. So wear your mask, keep your personal effects inside, and don't bring any guests with you. And come on in. So once you're inside, you can see we've reduced the number of chairs in the waiting room. We're going to have you call when you get to the parking lot and call us, and if the room is available, we're going to invite you to come on up. We're not planning on using the chairs in the waiting room, but life doesn't always work out the way we plan, so we do have some capacity. We're going to ask you when you get here, do you have any cold symptoms? Do you have any fevers? Have you been exposed to anybody you know with COVID? And if the answer is no, come on in. We're also going to take your temperature with an external thermometer to make sure that you don't have a fever. We're doing the same thing for our staffs. At this point in time, I have not had to use my hands for anything, and you should not have to use your hands for anything, because the important thing is we're going to reduce the number of touch spots that are going to happen throughout the office. We can't eliminate it completely, but we're going to do everything we can to minimize that. So as you come into the office, we'll do that little screening, and we're going to take you on back to the exam room. So come with me. Throughout the office, we're reducing the amount of clutter, so there's less things that can hold on to the virus. We'd also invite you to bring your own pen and stylus so that any signing that you have to do, you can do with your own device and you don't have to use one that's shared with somebody else. If you don't, we will have pens and styluses available. We have a clean container in the corner, or a dirty container in the corner, that will sanitize those objects after they've been touched, so everything that you're going to be able to touch here in the office will be clean. Come on back. In the treatment rooms, these are pretty clean spaces anyhow. As we're doing medical procedures, we've always been on the top of our game as far as cleanliness in the office. We're continually wiping these down with Sandy wipes and other sanitizing agents, and that will be no different. Again, I'll have my mask on, you'll have your mask on. We will have our discussion about what the treatment's going to entail. Once we're ready to go, you of course will be sitting here in the chair. We're going to wipe down the chairs all the time after you've done this. Again, all your personal effects are on your body. You should really only have to touch the armrests, and that will be about it. We will then do the procedure. If it's a procedure done on the face that will require us to remove the mask, we'll have you remove your mask. We'll do our procedure, put the mask back on. There'll be a lot of hand washing and sanitizing throughout the entire procedure. We'll have these here in the office where you're continuing clean. I always clean my hands before a procedure, and we'll clean them after to minimize the spread and movement of any germs that may occur during the procedure. When we're done, we'll go up to the front desk, or I'll go up to the front desk and get invoicing ready. Once we're sure everything is at the front desk ready for you to go, we'll bring you back to the front desk. Where we'll have you check out one person at a time. We don't want congestion here at this spot. There's a spot 6 feet away if we need to just have a backup of one person. Otherwise, we'll keep you in the exam room until the last possible second to, again, minimize interaction between people and keep things at a safe distance. Finish your interaction, you'll put your credit card in, you won't have to touch the machine other than to sign with your stylus, and off you go on your way. We'll be introducing extra procedures like storing credit card information if that is what you prefer. That will allow things to be safer from a viral perspective. You'll have to kind of balance that out with your security issues with your credit card. Those are in conflict, and that will be your choice. We hope that this kind of encourages you to kind of get out and start safely experiencing life again, and we hope to be part of that, and we look forward to seeing you soon.